Hi, I'm Dr. Mike, and this is NFGeeks. Well, this video is an Ask Dr. Mike video on the NFGeeks forum on Facebook. People post questions on Sundays, and whoever question gets the most likes gets a video answer from me. And the winner this week was Revo Consciousness. Pronounce that whatever way you want, I guess. And her question is about actually mental disabilities, which is right up my alley in all sorts of ways. So, here's her question. Can MBTI typing work or apply to a person with mental disabilities? For example, what about a person with Asperger's? Can they be accurately typed? I wonder if the neat categories of cognitive functions apply to people who defy the binary of genius and disability. Asperger's is just an example, but I'd really like to focus on autism more generally and other mental disabilities. Okay, so it's a very good question. I think there's a couple of ways of looking at it, breaking it down. So the first one is, does it apply? Does typing apply to people with, I'm going to say, mental health diagnoses? And I would say yes. Okay, that's my first answer. Okay, so does it apply? And what I mean by that is that, do mental health diagnoses disrupt personality type, or do people who have mental health diagnoses don't actually have a personality type and things like that? And I'd say no. And I think the issue with that is that people are not understanding mental health diagnoses as opposed to personality types. This is one of the times where personality type isn't the thing that's being misunderstood. Mental health diagnoses do not interfere with what your personality is. I mean, it relates to your personality, but it doesn't break down your personality or take something away from your personality type or give you some different personality type or something like that. Damages it, in some way, in a way that it's not that the type doesn't exist anymore, or that the rules of type don't apply. Okay, so everybody who has a mental health diagnosis has a personality type, whatever it is. Okay, whether that can be determined is a second question. We'll get to that. But everyone has a personality type. To be a human is to have some kind of personality type somewhere. Okay, anyone with mental health diagnoses is still a type. Now, they may not be exactly like the other types of their type because of the mental health diagnoses. They may be a specific group of it, what the mentally ill version of that is, but they still have that type, and the mental illness is still coming out through the type, and the type is still part of the mental illness in a way. Okay, in that the way the mental illness is manifesting is related to how the type manifests ideas, values, all of that stuff. Okay, so I definitely think that regardless of what your mental health diagnosis is, you have a specific type. Your type is still there. Okay. Now, with some diagnoses, that's less obvious than others. So, for example, it's fairly easy to to type somebody who has anxiety disorders. Okay. You can still sort of be self-aware, even though you may have some severe form of OCD. I think mood disorders, people with mood disorders can be easily typed. They're just NFs. How hard is that? Just kidding. But I still think you could be depressed and still be accurately typed. Okay. Now the question is, what if you have an extreme mental health diagnosis? Does that make a difference? I would still say you still have a type. Okay, first of all. So, for example, one of the mistakes people make is about dissociative identity disorder. Okay, and that used to be called multiple personality disorder. And I think that messes people up when thinking about it, because people start thinking, well, they're simultaneously an ISTJ and an ENFP and an ISFP or whatever, and that's not the case exactly. I mean, it's a little bit like that, but really what happens in dissociative identity disorder is that people dissociate. When dissociating means when you separate one part of your mind from another part of your mind in terms of thinking. Okay, so you sort of break up your thought schema, so now you can't get to one set of thoughts from the other set of thoughts, that kind of stuff. And how that affects personality is because the parts are separated, there's no one identity holding it. Okay, so or it's being masked somehow, or the connections have been separated. But that doesn't mean you don't have a type. It may mean that different parts of a type may manifest in a way that seems like it's independent. Okay, so you might have, if I'm an ENFP and I have dissociative identity disorder, my ISTJ shadow side may come out and I may give it a voice that it reals, but it doesn't exist as equals. It's still my shadow, it still exists where it exists, I'm just sort of voicing it now in a way that I normally wouldn't. This can be seen because there's other things that don't relate to personality type in dissociative identity disorder. Like there's always an inner child, there's always a child version that comes out, that wounded child that has been separated from the self for whatever reasons. Severe psychological trauma, to be, that's usually the culprit, if not the only culprit. There's usually an angry one. There's usually an angry side, that's sort of acting as if it's independent, but none of these things are actually independent. A person with dissociative identity disorder has a personality type, but the trauma, the severe psychological trauma, has splintered things away from the identity so that they appear as if they're separate things. All right, but they're not actually separate things. You don't actually have separate personalities. You have different parts of your personality disconnected that are coming out. That's what happens, okay? But there's still a type in there. There's easily still a type. So then let's talk about Asperger's and autism. So first of all, they've sort of been lumped together a little bit, because they have sort of similar behaviors or similar things going on. Repetition of behaviors, repetition of patterns, communication issues, social interaction issues, things like that. Sort of very one-sided conversations, but the difference is that Asperger's, the developmental delays are sort of lesser in a way, and thus these people, the Asperger's people can function in a social situation a lot better than the autism person. But it's still part of the autistic spectrum disorder. There's less disconnect going on now between those things. Now, do people with autism or Asperger's have a type? I would argue yes, that they do. Okay. In fact, my experience has been a lot of Asperger's or Aspergery. People who are kind of Aspergery, I'm making up that word, but people who are kind of Aspergery seem to be either INTJs or ISTJs. Okay. In my experience, that has been the most. I think you could throw some INTP in there, and maybe introverts in general, or introverted thinkers in general, maybe, who knows. But it seems that my experience has been INTJ, ISTJ has had a cluster. And that's important because I think that I think there are mental health diagnoses that have comorbidity with certain personality types. That means they connect, they cluster together. Okay, it doesn't mean you can't have the disorder in any other type. I mean, I'm sure you can, but there seems to be an average, a curve, again, a cluster. And I find that Aspergery people are often INTJs. That doesn't mean every INTJ has Asperger's, but a lot of the Asperger people I know are close to Asperger's, or maybe even have Asperger's, seem to be INTJ. So there's something going on there. There's some kind of cluster of going on, or similar interactions. Okay, I mean that actually makes it easier to type an autistic person. Okay, because you can take the behaviors and look at the type and see how these things go together. But it definitely kind of shows this crossover between these things. Okay, in my opinion. So, all right. So the first question is: do people have a type even though they have, a specific mental health diagnoses that may seem to repress it? The answer is yes, they still have a type. There might be some kind of cognitive function atrophy going on. Okay, we have to keep that in mind. Like in the Asperger's or autism, the ability to have empathy may be very, very small, due to whatever's neurologically going on. To the point of it looking like it's absent, but it's really still there, but in its most small, minuscule, way it could be done, shrunken down, if you will, due to the neurological stuff. And I also think that's important to know because I think that you have to get to a point where there's severe neurological problems before we start talking about does type actually exist in that person. So, for example, I think if you're below an IQ of maybe 40, 30, when you get to very, very low IQs, very severe mental retardation. We may have such an extreme form of cognitive function atrophy that it might as well not exist, or maybe it doesn't exist. I don't know. And we start having, a thought process that, or maybe not even a thought process, a neurological process that's similar to, reptiles. Maybe we could start thinking about whether type actually exists. But I think it would take that low. I think people with Down syndrome absolutely have type. Absolutely have type. And you have to, even if they have very low IQ, 60, maybe even 50, I definitely think type is still there. So, yes. My answer is to that. Now, the second question is, how would you do that? How can you type? I mean, they have a type. How can you figure out that type? That's a different question, and that's a harder question, okay? Because we don't know what type of self-awareness that they have, okay, in terms of typing, and even if they're getting it right. And they could be even conscious of that. So, for example, people with narcissistic personality disorder, if they're fairly intelligent, or worse, they have antisocial, they're sociopaths, they may be able to answer the questions correctly in a way that doesn't show their type. It's possible. I think they would still show their hand in a way because, they don't really understand what they're typing, what they're answering. But still, it's hypothetically, they could weasel out of it, So there's two things then. How do we figure out type for people of, let's say, Asperger's or autism or mental health issues that seem to totally interfere with the ability to type? Okay, that could be like severe depression, for example. Well, I think there's two answers. One is, if assuming we don't change the inventory or inventories, it would require a much longer qualitative process, which nobody seems to want to do in typology. Everybody wants to get it down 5 seconds. But actually, if we're really going to help mental health, people with mental health diagnoses, a longer interaction of doing maybe multiple typology inventories and having an interview and a dialogue and qualitative research and observational research could probably get us closer to the type of what that is, especially if we're talking about people with Asperger's or autism or dissociative identity disorder, people that, disorders that seem to really disrupt the ability to figure that out. So again, a much longer process could do it. A second one, and this is why, I don't know, I'm going to beat this dead horse again, this is why personality type and the MBTI needs to be in academia, because a better inventory tool alone, a much more complex and much better built inventory tool that's measuring more things could pull this off and tell us the type of anybody, even if they're narcissists and sociopaths, okay? And psychology has their version of it, and that's the old MMPI, okay, the Minnesota Multiphasic Inventory, okay? And there's all sorts of editions now. I mean, now they're up to like the MMPI Enterprise D or something. There's several generations down there. But this is a wonderful tool. I actually saw it in action when I was getting that when I originally was getting a master's degree in psychology. It was very fast. It takes forever to take it too. But what they're able to do with that is, based on your personality type, and it's 5-factor stuff, but based on those questions, they can determine the mental health disorder you're most likely to have. Okay. Now, there's two things that we can do with that. All right. One is that we can, in typology, it'd be great if we can reverse engineer it. Okay. Which means, based on your mental health diagnosis, what personality type are you most likely to have? That would be kind of cool. But the second thing is that it would require a huge amount of research of the tool itself. That's how they got the MMPI to this level, is that the entire world of academic research in the social sciences and psychology and testing in particular researched this thing up the wazoo, researched every item in the inventory, researched inter-rater reliability. I mean, all these things were researched incredibly. Every single item, every single question was researched. And what they were able to do is link up certain questions, whether or not you're being truthful, whether or not your answer is the actual answer for a certain question. You could answer wrong answers or try to trick it, and it knows you're trying to trick it. It's been designed in such a way that it can statistically be sort of proven, well, maybe not proven, but statistically shown that it's more likely you are lying or giving different answers than you should be, and there's a whole bunch of questions like that. So a tool that is better refined through, and it's got to be through academia, because that's where all the true tools are. All the true researchers who know how to do psychological testing, how to do psychological research, how to find subjects to do the psychological research. It's important, and there's huge implications. The MMPI is used everywhere. It's used in the military, it's used in prisons, it's used in mental health hospitals. I mean, it's all over the place. It's used in a ton of ways. So there's a huge amount of research behind it. That's why it's there. Because this entire machine of academia, this entire culture of academia has been working on it. It's not just one or two people talking on a message board. It's not just one non-profit. It's hundreds and thousands of individuals, teaching assistants and graduate students and doctoral students and people with PhDs doing research at universities across the nation and probably across the world, that have been working on this inventory, and that's why it does what it does. And we don't have that. Okay, we don't have anything remotely close to that. So to be able to type people with severe mental health diagnoses, we must have an inventory that is complex enough to connect mental health with personality type and able to determine if answers are correct answers, or if something's going on in terms of mental health, or just straight up lying, because the MMPI can do that. Okay, so if we could do that, then we would have something much more viable. And that's why I always say, academia. We gotta go to academia. Okay. All right. Well, that's my answer for this. I guess the last thing I want to throw in is just that really typology, and I've said this before, but typology could be so useful in mental health services. Okay, it would absolutely help in terms of therapy. It would send therapy several months ahead. Okay, a whole really maybe even a year. I mean, if you can understand someone's personality type, you can understand the way they process, how they take in information, how they're going to behave, what are their values. I mean, a whole bunch of information, and then you could treat them based on that. You know what I mean? You could come up with answers and strategies and ways of living that are type specific. Okay, and that would be really, really, really helpful with people with autism and Asperger's. Okay, really helpful, because they can't get there on their own. Okay, and a lot of treatment for them is shots in the dark. It's all behavioral. You know what I mean? It's not really trying to improve their quality of life. I mean, people want to improve their quality of life, but they can't get there. Typology can help that. Okay, as opposed to just managing behavior, which is what happens, for the most part. Okay, so that's it. That's my answer, and I'm sticking to it. All right.